Right, update on clinical management of COVID-19. Positive test for COVID-19 virus is not mandatory now for admission to a COVID health facility. National policy for admission of COVID patients in hospitals has been revised. Now, no patient will be refused services on any count. For more on this, I'm joined by Times Network Shireen Elizabeth on the broadcast. Shireen, thank you for joining us. This comes as a big relief for those people who were earlier denied admission because they did not have a COVID positive report. What more can you tell us about this new order?
Absolutely. This is a very significant step by the Health Ministry and also a relief to a number of people across the country, because remember, Mirror now has also reported how due to the overload in the lab, the RT-PCR test results are getting delayed, and hence, eventually the hospital admission also was getting delayed, because remember, most of the hospitals have made it very much mandatory according to the admission policy that there needs to be an RT-PCR test, positive test report, and then only the admission will happen. But now, with the revised national policy for admission of COVID patients, the Health Ministry is saying that the positive test for COVID-19 is not mandatory anymore for admission to a COVID health facility, and no patient will be refused services on any account. Now, there are 4 points that have been put out by the Health Ministry as part of the revised national policy for admission. That is, the requirement of a positive test for COVID-19 virus is not mandatory for admission to a COVID health facility. A suspect case shall be admitted to the suspect ward of the healthcare facility. Other than that, no patient will be refused services on any account. This includes medications such as oxygen or essential drugs, even if the patient belongs to a different city. And the third point that the Health Ministry in the revised admission policy says that no patient shall be refused admission on the ground that he or she is not able to produce a valid identity card that does not belong to the city where the hospital is located. And admission to a hospital must be based on the needs. It should be ensured that the beds are not occupied by a person who do not need hospitalization. So once again, the government is in fact telling the hospitals, both private as well as the government hospitals, that the priority needs to be given to the patient who immediately needs a bed, who immediately needs to be hospitalized. And it should not be given to some patient who's not really required a hospitalization. Maybe they just need home isolation. That would be enough for them. But the priority should be given to patients who absolutely need the beds and hospitalization. So these are the new revised national policy for admission of COVID patients that has in fact now been put out by the Health Ministry.
All right. Thank you so much, Shireen, for getting us those updates.